Kimberly Combs, and I am an audiologist and the owner of Sound Hearing Care. And we are located very close, right at the corner of Butler Warren and Tylersville Roads next to GE Credit Union. And we are here today to talk about hearing loss, the causes, and what we can do about it. I have the distinct pleasure of having with us today Jane Bachman. She is an audiologist and actually comes to us from New York from one of the hearing aid companies, Widex. And she is a great presenter, and I want to welcome her and thank her for coming to be with us today.
But as she said, my name is Jane Bachman. I'm an audiologist with Widex. I travel all over the Northeast to present and teach people about our technology at Widex. And I'll talk about Widex in a little bit so that you have an idea of who we are as a company and what we do. But just to highlight what Kim does, she has a great practice. She sees patients of all ages. She does diagnostic work to test your hearing. We have to know about your hearing before we can treat it. So she does diagnostic work as well as the treatment of hearing loss for all ages, children and adults. So we're today going to talk about hearing loss and hearing testing, what we're looking for if you come to the office and say that you have a hearing test. Yeah, can we maybe turn it? There we go. That's better. Understand how hearing loss can affect you and your family members and your loved ones. Review different types of hearing aid technology that is available currently. Determine what type of hearing aids are best for you. That's a very difficult question that a lot of you are wondering. A lot of people are wondering that because there are so many different advertisements anymore, commercials, flyers that you get in the mail talking about the latest, greatest hearing aid technology. Well, how do you sort through that? How do you really know what's going to be the best for you? So we'll talk about that and learn specifically about Widex technology. So a quick fact about hearing loss: over 31 million people, or about 10% of the population, have hearing loss. It's actually a very common disorder. It affects people of all ages, mostly those over age 65, but it does affect all ages. It's a very common birth defect. Babies are born with hearing loss every day. So it's kind of a stigma that it's more associated with older adults, but that's really not true. Warning signs of hearing loss. Well, if you have to communicate with your family members like this, that could be a warning sign of hearing loss. But seriously, you can hear people but not necessarily understand them very well. It might seem that the volume is comfortable of the speaker, but it's just not clear enough. A couple others, having difficulty hearing in restaurants or when you go to church. If you don't sit right up in the front at church, maybe you don't hear very well. Or if you aren't watching people when they're talking at a restaurant, you're not able to hear very well. Having to ask people to repeat frequently. Looking at people's faces, turning up the volume on the television or the radio, and feeling that everyone mumbles or doesn't speak clearly. So if you feel that way or your spouse feels that way, if they say, "You just never talk loud enough," that might be a warning sign that they have hearing loss. I'm sure you are talking pretty clearly and loud enough, so that would definitely be a warning sign. A couple other facts. Hearing loss is ranked as the third most disabling but treatable condition. So that's a good thing. Although it's very common, it is treatable. Hearing loss is the #1 birth defect in the United States. 1 out of every 50 children under the age of 18 either is born with a hearing loss or can develop a hearing loss in their childhood. Hearing loss can negatively impact the quality of life. It can impact your personal relationships. You may have, arguments with your spouse or your family members over who's not talking loud enough or who's mumbling, who's not talking clearly. So it definitely has a negative impact on us in one way or another, whether it's with family members or at work. So hearing loss can separate us from things that we love, like music. If you love listening to music, it may be difficult if you do have a hearing loss now to hear music clearly or hear it the way that you used to hear it, and that may be very frustrating to you. It can separate us from those who hear well. So if the rest of your family hears very well and they don't need the television turned up and they don't need the radio turned up, that can create a barrier or a separation between you and the ones that you love. Environmental sounds, so hearing things like the waves at the ocean, hearing birds chirping in the morning. When you have a hearing loss, you may be missing out on some of those things. And if you've had a hearing loss kind of gradually over time, you may not even really realize that you're missing out on some of these sounds anymore. And it can definitely separate us from those that we love. So again, going back to those that can hear better than us, or just some of the struggles that you may encounter. If your spouse can hear better than you and they get frustrated with you, that you constantly ask them to repeat, or that you miss certain things. So it can definitely impact and separate us from those that we care about. So there were some studies done about the impact of hearing loss. This was a large-scale study of older adults and their families. Things that can happen when you have an untreated hearing loss. So what can happen over time? Well, it can lead to sadness or depression, feeling a little bit isolated from the people that you care about because you can't hear them very well anymore. Feeling anxious a lot, and maybe you don't want to go to certain places anymore because you don't hear very well. You used to be very involved in the community, or you used to volunteer, but your hearing loss maybe started to cause some problems that you weren't able to hear very well in those situations. It can cause emotional turmoil and paranoia as well. I know a lot of people experience that, just not wanting to go anywhere because they're just afraid that they're going to hear something incorrectly and maybe embarrass themselves, or they're just not going to be comfortable in that situation if they aren't able to hear very well. And all of those, whether you experience one or several of those on the list, that can definitely negatively impact your quality of life. So how do we hear? We're going to kind of move on now to how we hear and briefly overview the anatomy of the ear. So we hear with two ears. We were born with two ears for a reason. Those two ears actually work together, and our ears are just a means of sending sound up to the brain. So what you see in that image there is that sound is entering his ears, but it's really up in the brain that we hear and understand sound. So just think of that. The ears are just kind of a pathway of sound up to the brain. Two ears are more effective in processing sound. That's why we were born with two ears. Our brain is designed to receive input from two ears. And you can see that if you ever just plugged your ear with one finger or put a piece of cotton in your ear. There's a big difference when you do that, and it is more difficult, obviously, to understand and to hear things when you have plugged one ear. So we really need to hear, and we will hear best with two ears. Without such processing, we have an incomplete sound picture. So if you plugged your ear, you're not getting the full kind of 3D sound that we're designed to hear. If you plug this ear, then you're really missing out on a lot of sound coming from that side, and that opposite ear cannot pick that up well enough. So you're getting an incomplete picture if you aren't hearing well with both ears. So advantages of hearing with both of your ears: hearing soft and distant speech. Of course, the more hearing that you have on both sides, the more you can pick up from all those different sides. Sound discrimination means being able to tell apart different sounds. So whether it's the beeping of the microwave or an alarm clock going off, being able to tell the difference between those sounds, you can do that better when you're hearing with two ears. Ability to hear sounds from both sides of the head, I kind of mentioned that already. If one ear hears very well, but the other one does not, that better ear does not compensate well enough for the side that's not hearing as well. Ease of locating the sound source. If someone calls your name or you are hearing something beeping in your house, you can hear that better when both ears are processing well. It's less stressful as well when you're hearing with both ears. And you will have improved speech understanding. They've done lots of studies on that as well, seeing how much better people are able to process speech when they're listening with both ears. So we'll kind of talk more about binaural hearing and why that's so important, especially when it comes to treating a hearing loss. If you have a hearing loss in both ears, we would certainly recommend a hearing aid in both ears. But also, if one ear is better than the other, we often still recommend two hearing instruments because of all of these reasons. So if there's a hearing loss in both ears, but one is still better than the other, we typically do still recommend a hearing instrument in both ears for all of these reasons. So hearing with both ears provides the best possible situation for communication wherever you are, whether you're in quiet situations or in noisy situations, hearing with both ears is best. So anatomy of the ear, how does the ear work? There are different components of the ear. We'll start with the outer ear. The outer ear is the portion of the ear that you can see. It's the pinna, which is your earlobe essentially, and then your ear canal. Your eardrum is the end of the outer ear. Beyond that, we start the middle ear, and there are three tiny little bones in the middle ear, they're called ossicles, that send sound beyond that into the inner ear. And the inner ear is really where sound is first beginning to be processed in what's called the cochlea. So that kind of looks like a snail to me, but the spiral portion of that snail is called the cochlea, and that is what processes sound in some way for the first time. So those are the three components of the ear: the outer, the middle, and the inner ear. That middle ear canal, where those three little bones are, that's typically where people experience ear infections. If you've ever had an ear infection, or you know your grandkids or some of your family members have ever had ear infections, that's typically where that happens, in that space where those three little bones, where they live. So that's just a little quick fact about the middle ear. So I don't have the ability to press the button on this. If you want to run back there for me, that'd be great. This is just a quick video or animation of how sound travels through the ear, so you have an understanding of what's going on when sound enters your ear. Oh, sorry, if you want to hit the arrow back button. Can you hit the up arrow? And then if you use the mouse, there's a play button on that animation. There we go. Yeah, sorry about that. I should have prepped you. Oh, shoot. I'm sorry. Can you hit the play button again? So there are red signals here that will come through. It shows sound entering the ear canal. It bounces off that eardrum, which actually moves those little ear bones, those three ear bones. Those bones will displace a fluid in that blue portion of the ear, the cochlea. And when it displaces fluid, that's kind of the first time that sound is interpreted for the first time, where, what kind of frequency the sound is, how loud the sound is. So that occurs in that cochlea. So that's just an animation I wanted to show you of how sound enters and passes through the different parts of the ear. There are different types of hearing loss. Two main types. One is called conductive. This is not as common as the other type that we're going to talk about in a moment, but if you hear the word conductive, what might that mean to you? I mean, to me, it means that something is not allowing sound to be conducted through the anatomy of the ear. Something is kind of blocking the sound or not permitting it to travel the way that you just saw on that animation. So a conductive hearing loss occurs in the ear canal. It can occur with the eardrum or parts of the middle ear, like if you had an ear infection. If you have fluid in your ear, in your middle ear space, that's not going to allow sound to pass through the ear the way it's supposed to. So this can happen from earwax. If you've ever had a blocked ear canal because of earwax, if you've ever had trauma to your eardrum, maybe you were in an accident, you bumped your head on something, or you know somebody that this has happened to, that can perforate your eardrum. And when there's a hole in the eardrum, it doesn't allow sound to travel through it the way that it's supposed to. So that can cause a conductive hearing loss. And another type of trauma that can actually break those bones. Those bones are very small. And they can be broken if they are, hit hard enough in an accident or something of that sort. So this is the type of hearing loss that can most commonly be corrected for someone that's experiencing it, but the bad thing here is that it only represents about 5% of all hearing loss. So although this can typically be corrected, it's not the most common type of hearing loss. The most common type of hearing loss is what we call sensory neural. So that's something beyond the outer ear and the middle ear. There's something going on in that cochlea that's not allowing sound to be understood the way that it used to be. So this is about 95% of all types of hearing loss. It's often called nerve loss or nerve damage, if you've ever been told that before after a hearing test, that you have nerve loss. This can be caused by aging, noise exposure, disease. Lots of different types of disease can cause a permanent hearing loss, and genetics. So if you just have a family history of hearing loss, this is most likely the type of hearing loss that you have. Unfortunately, this is not something that can be corrected. So sensory neural means that it's more of a permanent hearing loss. And when you have this type of hearing loss, because there's no surgical or medical treatment for it, hearing aids are most likely what would be recommended after that hearing loss is discovered. This is a real picture of the cochlea, that spiral organ. This is a nice, healthy cochlea. There are like little nerves or nerve endings in that cochlea that understand sound. And so this is what a nice, healthy one would look like. And you can see around that spiral, there are all these little healthy fibers along that. Next to it is the picture of a damaged cochlea. So the red arrows there are pointing to where you no longer see those fibers. And think of those fibers as little blades of grass. If those little blades of grass become broken, like they can because of noise exposure or disease or genetics, having a hearing loss because of genetics, we cannot correct that. So those little blades of grass that understand sound in the cochlea cannot be regrown, at least at this point. So if you have a type of hearing loss caused by noise exposure or something in the past, a medication that you had to take in the past that damaged your hearing, this is what happened. It damaged that cochlea, and there's really nothing medically that can be done, at least at this point, to correct that. So how do we know if someone has a hearing loss? This is a graph called an audiogram. This is how we determine whether a hearing loss is present. So we're going to take a look at what the audiogram is showing us, what information that we're gathering from that. And this is measuring your ability to hear sounds at different pitches, which are different frequencies, like a piano, like a keyboard on a piano. Those are different pitches, and loudness in levels of decibels. So across the top of this graph, those are the pitches, starting at 250 up to 8,000. We test those different pitches during a standard hearing test to understand how you can hear all of those different types of sound. Now on the left-hand side, we're measuring the loudness. So how loud do we have to make a sound for you to hear it? And we're looking for a threshold of sound. So we're looking for the very softest sound that you can hear at each of those frequencies.